According to ethical condition, the man was not guilty for the murder and should not go to jail for the death penalty. But according to law, the man was guilty of murder and should go to jail because he had no authority to give pills to his wife, whether she asked him to ask him for these pills because she was sick of her disease and pain of life. So according to man's perspective, he didn't attempt any crime as he fulfilled his wife's last wish and give her relief from a horrible disease. Court has to give some relief to men who face wife disease since many years, and now his wife want death, which was not be willing to die her wife and want to spend a life with her, but his wife facing a long disease which has no positive sign and create a continuous pain for the husband because she know that he feels pain after seeing her in the pathetic condition. According to given paragraph, man ethically not liable for her wife's death because he was not giving her injection or of pills with willingness. She was suffering low carrier disease with severe heart diseases, so he was spent her life with pain and medicine. He could not walk or talk and used tube for eating and drinking. Her husband was take care of her with love and affection, but she was tired of her disease and want to finish her life and finish her pain as soon as possible. It was said that the husband was loyal and loving partner who did everything for her to take care of his wife. The man delivered an injection of sleeping drugs that had been mashed up to his wife. Following the administration of the sleeping tablet, the wife experienced a temporary loss of consciousness, but she did not pass away. Ethically, the man should not face any punishment because he performed all the act according to his wife's wish and she faced lot of pain due to her disease. The state of Oregon passed a law known as Death with Dignity Act, which enables terminally ill people to end their life with dignity by voluntarily self-administering fatal drugs that have been expressly prescribed by a doctor for the purpose of ending their lives. The Oregon Death with Dignity Act requires the Oregon Health Authority to collect information about patient and physician who engage in the act and publish an annual static report. This requirement is in place to ensure that patient and physician have the opportunity to exercise their right to die with dignity. In 1997, the state of Oregon passed a law known as the Death with Dignity Act, which enables terminally ill people to end their life with dignity by voluntarily self-administering a fatal amount of medication that has been expressly prescribed by a doctor for the purpose of ending their life. The DWDA mandate that the Oregon Health Authority compiles a report every year and gather data on the number of people who participate in the DWDA. Our instance is one of the neutrality, and we feel that parties on both sides of the issue should give serious consideration to this fact, even though it is not our responsibility to provide interpretation of the DWDA. We frequently get questions concerning the law. There is no program offered by the state to encourage involvement in the DWDA. Individuals do not make an application to the state of Oregon or the Oregon Health Authority. Implementation of the DWDA on an individual level is left up to qualified patient and physician who are licensed to practice medicine. Participation in this event is entirely voluntary. The DWDA mandate that the Oregon Health Authority compiles a report each year and gather data pertaining to the state participation in the Death with Dignity Act. So according to this law, he will ill, the ill person asks for death, but his doctor consult with his member of hospital where the patient admit and consider that what kind of condition patient is facing and how much remaining life is left for the patient. According to the law, this condition applicable when the life of the patient is left less than 6 months.